Before we begin, I want you to hear one sentence that could save you from making one of the biggest medical mistakes of your life after age 60. A surgeon's recommendation is not a verdict. Let me repeat that because it may be the most important thing you hear today. A surgeon's recommendation is not a verdict. Yet every year, millions of older adults hear the words, "You need surgery," and immediately assume the decision has already been made. They believe there is no discussion, no alternatives, no questions left to ask. They think the future has already been decided. But what if I told you that some of the most life-changing consequences of surgery have very little to do with the operation itself? What if the greatest danger isn't what happens in the operating room, but what happens in the weeks and months afterward? And what if the difference between maintaining your independence and losing it forever depends on questions most people never ask? Stay with me because surgery number 4 surprises almost everyone, and surgery number 5 may completely change the way you think about every medical decision after age 75. Before we begin, if you're committed to protecting your health, maintaining your independence, and learning the truths about aging that many people never hear until it's too late, take a moment right now to subscribe to the channel and turn on notifications. Every week, we share evidence-based guidance specifically designed for adults over 60 who want to stay healthy, stay informed, and stay in control of their healthcare decisions. And if you've ever had surgery or know someone who has, tell me in the comments where you're watching from and whether recovery was easier or harder than expected. I read every comment and your experience may help someone else. Now let's talk about a concept that every older adult needs to understand before agreeing to any major procedure. I call it the recovery gap. Most people ask one question when surgery is recommended: will I survive the operation? But after age 60, a far more important question may be, will I recover from the operation? Modern surgery is safer than ever. Anesthesia is safer. Surgical techniques are more advanced. Hospitals have better technology than at any point in history. Yet despite these advances, many older adults never return to the level of independence they had before surgery. Why? Because aging changes the body's ability to recover from stress. Think of your body as a savings account. When you're younger, that account is full. Your heart has reserve. Your lungs have reserve. Your muscles have reserve. Your immune system responds quickly. Your brain recovers rapidly. But as the decades pass, chronic illnesses, medications, inflammation, injuries, and normal aging gradually reduce that reserve. You may still feel fine. You may still be independent. But when a major stress like surgery suddenly arrives, your body must make a massive withdrawal from that account. And if there isn't enough reserve available, recovery becomes much harder than expected. This is why two people can undergo the exact same surgery and have completely different outcomes. One returns home and resumes normal life. The other spends months in rehabilitation and never fully recovers. The difference is often not the operation. The difference is the reserve they brought into surgery. Keep that in mind as we discuss the first surgery on today's list. Surgery number 1. Open heart surgery in frail older adults. When Howard was 78, he had been living with a narrowing heart valve for years. His cardiologist monitored it carefully until the condition worsened and surgery was recommended. His family immediately agreed because the idea of doing nothing seemed dangerous. But what no one explained clearly enough was that the greatest risk wasn't necessarily the valve problem. It was Howard's frailty. Frailty is not the same thing as age. Some 80-year-olds are remarkably strong and active. Some 65-year-olds are physiologically fragile. Frailty is a medical condition characterized by reduced reserve, weakness, fatigue, slower recovery, unintentional weight loss, and decreased resilience to stress. Research consistently shows that frailty predicts poor surgical outcomes more accurately than age alone. Frail patients experience higher rates of infection, delirium, prolonged hospitalization, disability, and loss of independence after surgery. What many people don't realize is that there may be alternatives. For certain valve diseases, less invasive procedures such as TAVR can sometimes provide comparable benefits with significantly lower recovery burden. Yet many patients never ask whether these options have been fully evaluated. If open heart surgery is recommended, ask directly, Has my frailty been formally assessed? Are there less invasive alternatives available for my condition? What is my personal risk, not the average patient's risk? These questions could completely change the conversation. The second surgery is one of the most commonly misunderstood procedures in older adults. Aggressive spinal fusion surgery for chronic back pain. Back pain is incredibly frustrating. It affects sleep, mobility, travel, exercise, and quality of life. So when someone hears that surgery may solve the problem, it sounds like the answer they've been waiting for. But here's the truth that many people never hear. MRI findings do not always explain pain. In fact, many adults over 60 have significant degenerative changes on MRI and experience little or no pain at all. Meanwhile, some people with severe pain have surprisingly minor imaging findings. Evelyn was 71 when her MRI showed degenerative disc disease and spinal stenosis. A multi-level spinal fusion was recommended. Like many patients, she assumed surgery would provide lasting relief. But numerous studies have found that for many patients with chronic low back pain related to age-related degeneration, spinal fusion often does not produce dramatically better outcomes than intensive rehabilitation programs involving physical therapy, strength training, movement therapy, and pain management. The surgery itself is not minor. Recovery can take months. Complications may include infection, hardware failure, nerve injury, adjacent segment degeneration, persistent pain, and reduced mobility. This does not mean surgery is wrong. It means the decision deserves a deeper conversation. Before agreeing to spinal fusion, ask whether you've completed a structured physical therapy program. Ask how many patients with your exact diagnosis achieve meaningful long-term improvement. Ask whether decompression alone would be sufficient or whether fusion is truly necessary. Remember, imaging findings alone do not automatically create a surgical indication. The image shows anatomy. It does not always explain symptoms. And that's a distinction many patients never fully understand until after surgery. Now, before we continue to surgery number 3, I want you to think about something. Have you ever been told that a scan showed a problem that later turned out not to be the true cause of your symptoms? So, let me know in the comments. The stories people share here help educate thousands of viewers facing similar decisions. Because what comes next may be the most emotionally difficult surgery on today's list. Cancer surgery. And the conversation surrounding it is far more complicated than most people realize. Surgery number 3. Major cancer surgery in older adults. This next surgery requires careful discussion because unlike some of the procedures we've already covered, cancer surgery can absolutely save lives. In many cases, it offers the best chance for long-term survival. But there is another side of the conversation that deserves equal attention, especially after age 60. Vincent was 74 when he was diagnosed with pancreatic cancer. After extensive testing, doctors determined that the tumor appeared removable. A major operation known as the Whipple procedure was recommended. On the surface, the decision seemed straightforward. Remove the cancer. Improve survival. Move forward. But what many patients don't realize is that surviving the operation is only the first challenge. Recovering well enough to benefit from the next stage of treatment is often the real battle. Major cancer surgeries place extraordinary stress on the body. Recovery may involve prolonged hospitalization, significant weight loss, muscle loss, weakness, digestive complications, and months of rehabilitation. For older adults with reduced physiological reserve, the burden can be enormous. Research consistently shows that frailty, poor nutrition, limited mobility, and multiple chronic conditions significantly increase the risk of complications after major cancer surgery. Some patients recover remarkably well. Others never return to their previous level of independence. This is why every older adult facing major cancer surgery should ask not only, can this surgery remove the cancer? But also, what will my quality of life look like afterward? Another important question is whether a geriatric oncology assessment has been performed. These specialized evaluations examine the entire person, not just the tumor. They assess frailty, cognition, nutritional status, social support, mobility, and overall resilience. Sometimes the results confirm that surgery is the best option. Other times they reveal that a less aggressive approach may provide a better balance between survival and quality of life. The goal is not to avoid treatment. The goal is to ensure that treatment aligns with your personal values, your goals, and your ability to recover. Because medicine should treat the whole person, not just the disease. Now we come to the surgery that surprises almost everyone on this list because millions of people consider it routine. Surgery number 4. Hip and knee replacement in medically complex older adults. Let me start by saying something important. Hip and knee replacement are among the most successful procedures in modern medicine. For the right patient, they can dramatically reduce pain, restore mobility, improve independence, and transform quality of life. Many patients say they wish they had done it years earlier. But the phrase, "for the right patient," matters more than most people realize. Francis was 76 and suffered from severe knee arthritis. Walking was painful. Stairs felt impossible. Everyday activities had become exhausting. Her surgeon recommended knee replacement, and from an orthopedic perspective, the recommendation was reasonable. But Francis also had heart failure, diabetes, kidney disease, and circulation problems. Suddenly, the conversation became far more complicated. Because surgery does not happen to a knee. Surgery happens to a human being. The heart must tolerate the stress. The kidneys must process medications. The immune system must prevent infection. The blood vessels must support healing. The brain must recover from anesthesia. When several chronic conditions are present simultaneously, recovery becomes significantly more challenging. Studies have shown that older adults with multiple medical conditions face higher risks of complications, infections, prolonged hospitalization, delayed healing, and reduced functional improvement following joint replacement. Yet one of the biggest misconceptions is the belief that elective means low risk. It does not. Elective simply means scheduled. And that scheduling creates a powerful opportunity. Creates time to prepare. Time to strengthen the body. Time to improve nutrition. Time to optimize blood sugar. Time to stabilize heart conditions. Time to build muscle. Time to increase resilience. In fact, some experts believe that preparation before surgery may influence outcomes almost as much as the surgery itself. If you are considering a hip or knee replacement, ask yourself whether your body is as ready as possible. Are you consuming enough protein? Are your chronic conditions well controlled? Are you physically active? Have you discussed your overall surgical risk with your primary care physician? The stronger you enter surgery, the stronger you are likely to emerge from it. And now we arrive at the final surgery on today's list. The one that changes the entire conversation because unlike the others, it often arrives without warning. Surgery number 5. Emergency abdominal surgery after age 75. This category includes conditions such as perforated bowel, intestinal obstruction, ruptured aneurysm, severe abdominal infection, perforated ulcer, and other life-threatening emergencies. What makes this surgery so important is that there is usually no time to prepare, no time to improve fitness, no time to improve nutrition, no time to gather multiple opinions. The crisis happens and decisions must be made immediately. Research has shown that emergency abdominal surgery carries some of the highest risks for older adults. Mortality rates are significantly higher than in younger populations, and even among survivors, many experience substantial declines in independence, mobility, and cognitive function. But there is something critical to understand. The outcome of an emergency often depends on decisions made years before the emergency occurs. Every walk you take today matters. Every strength exercise matters. Every healthy meal matters. Every effort to maintain muscle mass matters. Every conversation about your healthcare wishes matters. Because when a crisis arrives, your body can only draw upon the reserve it already possesses. Cannot instantly create new strength. Cannot instantly create new resilience. Can only use what you've built over time. That brings us to one of the most important tools I can give you today. I call it the Surgical Clarity Protocol. Whenever surgery is recommended, ask these 5 questions. First, what is my personal risk given my age, medical history, and current level of function? Second, has my frailty been formally assessed? Third, what alternatives exist and how do their outcomes compare with surgery? Fourth, what does recovery realistically look like for someone like me? And fifth, what happens if I choose to delay or decline surgery? These questions are not challenges. They are not signs of distrust. They are signs of engagement. They are signs that you are taking an active role in your healthcare. The best doctors welcome these conversations because informed patients make better decisions. Before we finish, I want to leave you with a simple 30-day challenge. For the next month, focus on building your recovery reserve. Increase your protein intake. Add resistance training 2 or 3 times per week. Walk consistently. Improve your sleep. Stay socially connected. And schedule a conversation with your doctor about your long-term health goals. These small actions may seem insignificant today, but together they build the resilience that protects you tomorrow. If there is one message I hope you remember from this video, it is this. A surgical recommendation is not a verdict. It is the beginning of a conversation about risks, recovery, alternatives, goals, and quality of life. The most successful patients I have known during my career were not the ones who automatically agreed to every recommendation. They were the ones who asked questions, understood the recovery as clearly as the procedure itself, and made decisions aligned with their own values and priorities. You have that right as well. You deserve clear answers. You deserve honest conversations. And you deserve healthcare that considers the entire person, not just a diagnosis on a chart. If this video helped you, take a moment right now to subscribe to the channel, click the notification bell, and join our growing community dedicated to healthy aging and informed healthcare decisions. And before you leave, I would love to hear from you. Have you ever undergone a surgery that was much harder to recover from than expected? Or has someone you love faced a difficult recovery after what was supposed to be a routine procedure? Share your experience in the comments below because your story may help someone else make a better decision. Thank you for spending this time with me today. Stay strong, stay informed, protect your independence, and I'll see you in the next video.